Hello, this is Dr. Lewerenz at Longevity Health Institute. Actually, I'm here in my Madison Heights office, which is AKA Lewerenz Medical Center. It's actually where I started practicing independently about 20 years ago. Long story short, though, is we're at the end of the day, and I wanted to share with you something that's real common here, but something how we really impact and help people. And you've heard me talk about it before. Wonderful things, very common, and I'm gonna give you a lot of info that you can implement and use in your life and share with others. And everything I'm gonna tell you right now, you yourself has experienced it or others that you know and love. So share this. Plus, at the end, I'm gonna tell you how you fix this. And it's an everyday thing, and that is fatigue. How do you fix fatigue? How do you assess fatigue? How do you fix fatigue? Why are we fatigued often? What are the effects of stress, and what is going on in our body that does this? So I'm going to share with you a patient story today, actually, and how we reverse fatigue, and particularly adrenal fatigue. Now, this can be poo-pooed in medicine sometimes that, oh, everybody has adrenal fatigue. And that is really not appropriate and not really accurate. The reason is that your adrenal gland is your fight or flight gland. And if you've dealt with months or years of stress, and I had two patients just today that had very significant adrenal fatigue. One was actually only 23, and this particular patient I'm going to share with you was 53. So very different, lifestyles, ages, okay, both female. But I'm going to share with you something that is really accurate, and that is that there's a bandwidth. We all have a bandwidth, okay? Here's low, here's optimal, here's surviving, here's thriving, okay? And if you really appreciate your adrenal gland and understand it, you'll understand here at the end what I'm talking about. You can't have good energy, you can't have good vitality, you can't have good stamina, you can't be able to go to work all day, exercise, care for others, care for loved ones, have some fun, and be happy and healthy, okay, without a balanced adrenal gland. So let's back up a bit. What is your adrenal gland in a nutshell? It is a gland near your kidney, on top of the kidney, that makes two hormones. One's cortisol, one's DHEA. I like to make things sound simple and to just break it down to everyone out there understand it. Call cortisol your gas. It's your gas for the day. You get good sleep, reparative, regenerative sleep, you make cortisol. It's like the gas tank's full. It's full in the morning, and throughout the day, your cortisol is spiking with stress and lifestyle stuff, and by night it's low, okay? But here's the deal. When you are constantly in stress, not just weeks, not even necessarily months, but when you're in months and months and months, or maybe years of stress, okay? And the older we are, the less we can take these stress effects. We don't regenerate and recover and rebound as quick, okay? So your adrenal gland gets taxed, okay? It's pumping out cortisol left and right, left and all day long, okay, from morning to night. And eventually the gland goes, hey, we're giving up, we're timing out on you, okay? And it starts to make less cortisol. So there's that old saying, what goes up must come down even lower. So again, if you're constantly producing a lot of adrenal, fight or flight, and this can be, your body knows no difference in stress, this can be too much work, too much exercise, emotional stress, divorce. So earlier today, this particular patient was telling me about family drama and turmoil between two different families, and divorces and stuff like that are very heart-pulling and emotional, and have actually really psychological stressors to the person, and particularly a female will be sensitive to this. But everything can be stressful. Your body doesn't know the difference in stress, whether it's too much exercise, not enough sleep, your boss yelling at you, a divorce, financial issues. Actually, I've even had many patients that are high-end, very successful executive businessmen or women, and they're just too much to go, and not enough recovery, building homes, moving, traveling, etc., and not enough recovery, okay? And they burn out, okay? The older we get, our adrenal gland makes the less of the adrenal hormone called DHEA, which is the governor of, I call it your brake or your governor. So cortisol is your gas, DHEA kind of keeps you from crashing, okay? The older we get, we make less DHEA, okay? So you can burn out easier. So a 20-year-old 30-year-old is not going to burn out as quick and as much or as significantly as a 40, 50, 60, 70-year-old, okay? So understand that. And the biggest thing is this, is that your adrenal gland, again, knows no difference. If you got years of stress, even if it's just emotional, or years of too much exercise, myself, actually, I've had adrenal fatigue a couple times, and you have to check in with yourself and be realistic, okay? If you're overexerting and overexercising and overdoing too much, okay, and not getting enough recovery, your adrenal gland is going to be taxed, okay? So a couple stories is that these two individuals over the last year or two had a lot of stress. One was work in school, and then used to be a high school athlete, high-end, even pre-college. Long story short, some emotional stuff with a boyfriend. Next thing you know, their adrenal gland's tanked. Okay, she actually has Epstein-Barr, so then her Epstein-Barr flares, spleen enlarges, belly pain, CT scan shows an enlarged spleen, and she's very, very, very tired, and literally in this kind of like just, brain foggy, dizzy, fatigue, crash in a day, anxiety, mood, irritability, because there's a lot of other hormones that are signaling in the body between the adrenal gland, including the thyroid, the pancreas, and the ovaries, and the pituitary, and all of a sudden you have this hormonal cascade going on that is all adrenals, okay, from stress. So again, it's what is our bandwidth and how much we burn out. Now, the other thing is, I want to share this with you. I see this more. It's not just particularly women, and this can happen to men, adrenal fatigue. Absolutely, I've seen it myself. I've had adrenal fatigue. But women are more prone to adrenal fatigue. And I personally believe, okay, that from an evolutionary standpoint, and I say this with care and love, please don't judge, is that women are more nurturers. They provide emotion. They care for family. They're emotionally tied to things a lot deeper than a man is innately, okay? We're more hunter-gatherers. We're more providers in some way, protectors, okay? Doesn't mean we don't care. Doesn't mean that we don't have those emotions, yet they won't innately gnaw at us, and I believe at a physiological pituitary adrenal level. So please understand that. So when we're talking stress, a lot of men won't understand what a woman is going through from a stress standpoint, and they adrenally burn out, and they kind of, so, remember, don't judge. Each gender has different stressors, but it can happen to both, but women are a little bit more susceptible, especially in 2020 and the last couple decades of how we live. We're expected, if we can do this, we can do this, and if we can do this, we can do this, and if we can do this, we can do this. Meaning we just push ourselves, and in 2020, besides, pandemic and economics and blah, 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 we are dealing with constant stress, whether it's bills, family, emotional, go here, go there, and and then you tie in politics and social media and etc. Next thing you know, you have a lot of stress that 30, 40, 50 years ago people weren't dealing with, and we can dissect that, or you can on your own later. Anyway, so when you burn out, okay, you start making less cortisol. Now, this individual, just because I have a documented here thing, I want to show you, you can see all the cortisols are extremely low. We have them do a salivary cortisol where they spit in the morning, afternoon, evening, and bedtime. And here's the graph right here. I put an X on it, and you can see right here, morning cortisol is like tanked. We call this flatlined all day. No gas in the tank in the morning, flat lines throughout the day, okay? Where I put that X is pretty much where they should be from a morning cortisol. And then they would have a normal diurnal pattern of kind of cortisols going up and down throughout the day. So this is significant stage 4 or 5 adrenal fatigue. What are their symptoms? Slow metabolism, weight gain, anxiety, moody, major fatigue, brain fog, photosensitivity, dizziness, lightheaded, inflammation, body aches, joint aches, come and go, you name it. I always say to people, when you have adrenal fatigue, you're just highly sensitive from a physical and a physiologic way. So how do we restore this, okay? First, we have to pump the brakes and go, why do you have adrenal fatigue? And I talk to all my patients about this, and I want you to share this with others and understand. And if you need our help, whether it's telemedicine around the country or new patient, that comes in, me and my practitioners are happy to help you and guide you here, okay, either of our offices with adrenal and fatigue issues. But you have to understand why you got there. So we have to dive deep into personal approaches to what happened the last months or years, okay? Why? Because we got to stop that. Whether we got to get you to a therapist, to a life coach, whether we got to get you off the HIIT training, too much exercise, or really just assess. And we don't give you those answers, but we present it to you that you can't keep pulling in every direction and having you stretch this far. So we have to stop the stressor. Then you can start regenerating your body. Better sleep, yoga, meditation, breathing exercises, walks in nature. There's studies that show just being outdoors and out in nature and witnessing, good air and breathing clean, fresh air, etc., is very rejuvenating and actually has a physiologic, healthy function on the body, okay? Getting good vitamin D, getting the sun, etc. Healthy eating, good raw, natural foods, very, very supportive to your adrenal gland. Okay, so we got to stop the stress, support the body, okay, and realize that maybe for 3 months, maybe 120 days, that you, the adrenal fatigue patient, needs to be, it sounds funny, but the center of the universe. Hey, listen, I need to self-love, and people that care and love for you will understand that. The other thing is there's a few key nutrients that really support the adrenal gland. One is vitamin C, high dose vitamin C, excellent for your adrenal gland to help restore cortisol. B vitamins, high B vitamins, all your B vitamins. Minerals, okay? I love to use the antioxidant CoQ10. Feeds the mitochondria for energy, so that taxing the system in each way, and so the mitochondria can restore, okay? The other thing is I like to use what are called adaptogenic herbs. Ashwagandha, rhodiola, ginseng. We use one here usually when people have that fight or flight, high stress, and they're really fatigued from Designs for Health. It's called Adrenatone. It's got adaptogenic herbs in it, calming yet supportive to the adrenal gland, but also helps them restore their cortisol function. The other thing that's very key, and I love to use this because it can really improve your energy, vitality, less symptoms from adrenal fatigue quickly, okay? And that is mineralized salts, pink salt, sea salt, Celtic salts, okay? I love the ones that have minerals in them because it has an aldactone hormone effect on your adrenal gland, stabilizes your blood pressure, typically raises your blood pressure numbers about 5 points. And as long as you don't have hypertension, okay, which we wouldn't guide somebody to have more salt with hypertension, but most of these patients with adrenal fatigue have very low blood pressure. My 23-year-old that came in today that was taxed from college and work and a relationship, actually her blood pressure was 86 over 56. She was dizzy, tired, lightheaded. When we give her salts that she'll do eighth or a quarter of a teaspoon of salt in a drink in the morning and afternoon, and modestly salt her foods with Mediterranean salts, pink sea salts, etc., she'll get a better blood pressure and a better adrenal response from that aldactone, and that'll help literally that day. She'll get better energy. Why? If you have low blood pressure, you're not perfusing your brain, okay, and so you're going to be brain foggy. So that extra 5 beats systolic blood pressure are an absolute benefit and a help, okay? And that can really impact you in day one of using it, okay? Now, I can't tell you, we have each individual case is very personalized, but these are the generalities. The other thing that we use and love, and I'm sitting here in my Madison Heights IV therapy room, is we use a lot of IV nutrients, IV vitamins, that we do very, very often for adrenal fatigue. In fact, probably it's our number 1 IV. We do 25,000 milligrams of vitamin C and a multi-mineral B vitamin, call it a multivitamin IV bag, but we always use 25 grams of vitamin C because it helps the adrenal gland directly, because we're bypassing the gut, get all these nutrients and make a vitamin C, make cortisol. So it is very, very direct. You bypass the gut, you get 100% of what we give you. and we'll put people on a course of these. Now, this patient who's in stage 5 adrenal fatigue, this flatline, this is going to take us probably a good 4 months, maybe even 6 months to fully restore. So I recommended she get about 6 to 8 IVs, and then we start tapering off 1 a week. And she's, luckily for her, December here at Longevity Health Institute and Lewerenz Medical Center, we do have a sale. We always do a sale once a year in December pre-holiday. We do IV vitamin packages, any of our IVs, infusion packages. We do 30% off for any package of 12. And this can literally save patients $1,000 or more. And people that have and need maybe a good 2, 3, 4 months or IVs, and they love them. So throughout the year, they can use these to help restore their adrenal gland, but also just for in general vitality and energy. Myself, I tend to get IV vitamins in 25-gram bag C's and multi-dose bags every 2 weeks, 4 weeks. Why? Keeps my adrenal gland sustained. I don't burn out at all, and it has wonderful effects on your cardiovascular system. Just had some lipids done. When I'm on vitamin C, my cholesterol drops about 30 points. It's amazing. Love it, and I have just nothing but benefits from it. But again, this patient, very interesting because again, this is going to take us a while. Why did this happen? Stress. The 23-year-old, same thing, chronic stress for a year or two. Okay, your body knows no difference. We're going to flood you with nutrients, minerals, herbals, like adaptogens, use IV vitamins, and get wonderful results. Honestly, I can say this, 100% of the time, we restore adrenal function here. It depends on your severity of adrenal fatigue. Sometimes it's a month or two, sometimes it's 6 months, okay? But we always do that. One thing that I do want to share with you, though, is your adrenal gland does make about 30% of your testosterone, particularly when you're younger, when you're under the age of like 40. So this 23-year-old was an ex-soccer athlete, worked out her whole life, very, very active, very, very, physically fit, liked to work out in that. Her intention with that kind of mindset of an athlete was to keep pushing physically, because when she used to work out, she would respond. She would feel better. She would actually get, that, oh, wow, I need to just work out harder, train harder, my energy will come up, etc. Well, she was going backwards. Remember, too much exercise is a stressor, especially if your adrenal gland is burnt out. So what did we do with her? We timed her out. She has the brain mind set as an athlete, which is this type A and driven, workout, train, go, go, go. Even at 23, we had to signlight her and say, hey, time out. You need yoga, you need stretching, you need regeneration and recovery, okay? But she also had a little bit of a depletion in her testosterone, about 20%. That's very common even when you're young, because the adrenal gland signals the ovary, and so now the ovary and adrenal gland are making less progesterone, testosterone, and cortisol. So she's gonna be more fatigued, she's gonna have more muscle aches, and this is exactly what she had, and she didn't respond to exercise as well, okay? Now, when we get her adrenal gland back, her testosterone's naturally gonna come up. She's young, so she's gonna restore that naturally just by the feedback loops hormonally. But that's something that we look at and focus on, because if she was 35, 40, 45, she might need, after adrenal restoration, maybe testosterone replacement. So very key, especially in an athlete, because they're very sensitive to their hormones. They're very in tune with their hormones, athletes are, and the testosterone is very, very specific for them, because their testosterone and hormone receptors are very unique to them. It's like genetics. So hopefully, this makes a lot of sense to you. When you see and you feel fatigue, you know somebody extremely fatigued, or they're always complaining for years of fatigue, send them this video, share this video with them. Adrenal fatigue is very real, okay? If it's any more real than this, it's an autoimmune condition called Addison's disease. You literally can't live with it. If you're not making cortisol, that's a hormone you have to have for life, okay? For thriving and surviving, for producing a blood pressure and a heart rate. So, adrenal fatigue needs to be taken serious. But yes, people have some mild conditions, and in this case, people have some more severe conditions. But again, I told you the fix. I told you how to approach it. I told you how to think about it. Any of the nutrients and things I mentioned you can get on our website, longevityhealthinstituteinc.com. Our fulfillment company, Carewell, you go on there, the password to order supplements is health. And, like I said, December here at Longevity Health Institute and Lewerenz Medical Center, we do have IV infusion special sale. 30% off, a package of 12, can be used at any time all year long. And we use them very often and very effectively for adrenal fatigue. Share this with others. Don't sit around on the couch and just be fatigued. Be proactive, fix your adrenal gland, and be well. This is Dr. Lewerenz. Take care.